we can overlay them, we can plan procedures with it. And our protocol in Colorado is that we don't repeat the angiogram, so actually helps with decreasing contrast and radiation during these procedures. But then the images can be manipulated and export them as a CT-like image and 384 slices from the Philips system specifically, and then we process them for print. So this has been a great process, and since then we've printed over 800 hearts for patient experience and education. We can see one of our first, this patient has the coarctation before and after. This was from the CT, and the other one was from the 3D rotational angiogram or 3D array from the cath lab. This is how it looks. We do a little box, have a label with our names. Now, obviously, this is changed. We place a little sticker and has the 4 of our interventionists in our program. So it's grown with time, and we can see the differences in this case, an RVOT stent before and after, and the family can see this and understand what we really did. And we printed at scale, and we're using a formless printer with draft material, so it's very quick. Turnaround is like an hour. I have segmented the images, and then it's post-processing thanks to a lot of the students from the Modern Human Anatomy Master Program here in campus that they come and do projects with me. So we can see a lot of the publications we work with, and a 3D printing has become a great tool for education for patients, and is part of our workflow nowadays, and is something sustainable, as you can see that we have specifically done it in the cath lab. This is a few of the QR codes for our program and articles about this, and our multidisciplinary work together to get things going on this specific field.